So this is my home turf. I'm a professor here at Stanford School of Medicine and work on health technology innovation, part of a Center for Biodesign and Center for Innovation in Global Health. Center for Biodesign is really focused on health technology innovation, so teaching innovators, faculty members, researchers, students, but also industry professionals on how to approach innovation in healthcare with unmet needs first. So needs-driven innovation is the term that we use. And then the other role I have is with Center for Innovation in Global Health, which is really healthcare innovation for the 5 billion people in the world out of 8 that do not have meaningful access to care. And many of those people are right here. We count about 100 million people in the US that fall within that category. Women's health is underserved. Pediatric health is underserved. And there are a lot more, if you really look, the communities and groups that are underserved in our healthcare system, despite the fact that we spend how much, 18% now, 18.5% of our GDP on healthcare. So the question really is, how do we overcome those challenges of providing meaningful access to healthcare to everyone, not just 3 billion who live in global north, but also 5 billion who live in global south. That's a question that I deal with at Center for Innovation Global Health. I didn't want this to be a presentation. I have no slides. I would like this to be a conversation. So please, I'll do maybe opening remarks next 5, 7 minutes, 10 minutes, and then I would love to actually engage you all. Can I see a show of hands? How many of you are in healthcare? Okay. And how many of you consider yourselves to be innovators in healthcare? Okay. I would like all hands to be raised. And the reason for that is that we often think of ourselves as users of healthcare. If we are part of an enterprise, a healthcare enterprise in particular, we think about healthcare as this static sort of framework where we have established health, care pathways, established protocols around healthcare, existing technologies, and we say we're going to use them and we're going to try to do the best we can. We're operationally will maximize the outcomes. The challenge with that is that it ignores all of the major evolutions that are happening in our technological landscape, and artificial intelligence right here is one of them. How many of you are working on AI or have exposure to AI? Or let me start from the basics, actually. How many of you used an AI tool? ChatGPT, show of hands. I hope all of you. There are now a plethora of these generative AI tools, so it really has become a major sort of evolution in AI. I mean, just in the 10 years that machine learning, deep learning has become the modality by which artificial intelligence is done. It's really created this movement that has led to what has happened in the last 2 years. It's nothing short of extraordinary. And when you have conversations with folks that are developing AI, algorithms and LLM models and reasoning models, one thing I hear constantly, whether it's OpenAI leadership or Perplexity folks or any of them, the one common refrain from all of them is that healthcare is going to be one of biggest use cases for them. So if you think about AI, what's going on today, it's really laying out the roads, the electricity poles, the undersea cables, things of that sort. That's what is going on with AI right now. Hundreds of billions of dollars have been invested in AI and will continue to be invested in the next 5, 7, maybe 10 years, in that infrastructure building. But it very quickly will give way to use cases. And ROI on all the investment that we see today will only come from use cases like healthcare. Healthcare is going to be one of the biggest ones. And why is healthcare one of the biggest use cases for AI? Well, there are 2 reasons. First of all, there are a lot of challenges in healthcare that we don't solve today, right? Unless there was an unmet need, unless there was a gap, unless there was a challenge, we wouldn't be able to use new tools, right? I mean, if everything is going well, why do you need AI as a tool? So that's one comment. The second one is that healthcare traditionally has been lagging in leveraging technology. I mean, if you go back to the times when Epic and Cerner came up with their, patient, management systems and patient records, PMRs, it was actually a push. It was a push from the payers for the hospitals to use those. Nobody liked it. Doctors didn't like it. Patients didn't like it. Even today, how many of you like the EMR systems you see in the hospital, where the doctor is sort of entering data. Well, nowadays they're using voice prompts, but even that's not as efficient. How many of you like the fact that the 7 minutes or 10 minutes that you spend with the doctor, half of that goes into entering data? Nobody, right? Nobody likes it. Does it improve patient care? No. Does it improve outcomes? Not really. What it does is that it helps the payers get the data that they need to make appropriate decisions around how much to cover and where the expenses are and so on. So it's more of a process tool. It's more of a benefit to one group of stakeholders at the expense of all the other stakeholders. And that is the challenge that we see. We see that technological tools that have been used in healthcare have really served the needs of a few, precious few, at the expense of folks that really healthcare is for, which is patients. So we're starting to see this flip. I call it flipping of the healthcare pyramid, if you will. In 20s, 30s, 40s, most of the healthcare was provided in our communities, at homes. I grew up in India, and we had a Dr. Jan in our neighborhood who basically provided 90% of my healthcare needs. I don't remember maybe I remember two or three times going to the hospital. Dr. Jan knew my clinical history. He knew my family background. He knew, when did I fall last time? So there was a personalized care that existed, even in the US in 20s, 30s, 40s. And ironically, it was a technology that took that care from home setting, community setting, to big institutions like Stanford Hospital, right? Where more and more machines, CT scanners, MRIs, and so on, and cath labs and so on, for more advanced care, of course. So for certain kinds of conditions, you absolutely need to go to the hospital. But we also start sending people with cough and cold to these big hospitals. So we moved away from home-based or community-based care to this institutional care, thanks to technology, ironically. Did the patient outcomes increase? Yeah, for advanced conditions, yes, they did. But for some of the most basic conditions, it didn't, actually. Patient satisfaction went down, outcomes were similar, costs went up. Thankfully, we are now entering an era, thanks to AI and thanks to other technological tools that AI will ride on, to bring that care back to homes and communities. So that's the promise that we see. But it's not going to happen overnight. It's going to take, in my opinion, at least 10 to 15 years, maybe 20 years, to really see full transition. I call it flipping of the healthcare pyramid, right? One simple experiment I ask folks to do when I'm speaking is, if you think of a healthcare pyramid where tertiary care at the very top and primary care at the bottom, where are most of the personnel? Where are most of the technologies? Where is most of the infrastructure? Where is most of the money being allocated? And at the top of the pyramid. Where are most of the patients, though? In the primary care setting. So if you think about where the healthcare can go, not just for global north, right here in our own communities, but also for global south. Should global south follow the way of the global north, which they are trying to? No, it's not the right model. Flipping of the healthcare pyramid would be the way that you create a lot of value. And that is why OpenAI is saying that 30% of their ROI is going to come from healthcare. They know that there are big challenges, and they know there's a huge opportunity. So that's really the future we are talking about. But we are not going to get there right away. We're going to take a decade, maybe more, to really get to that point. My hope is within my professional lifetime, I'll also get to see it. That's what I'm working on. But I think immediate opportunities for enterprises in healthcare is really improving processes, improving the current care. So we're not going to suddenly send patients to homes or community-based clinics, although Kaiser is trying to do that, others are trying to do that. We're not going to suddenly send everybody for surgeries, although we do have ambulatory surgical centers that are trying to do it. Those are piecemeal efforts. I think most of the care will still be provided at the institutions like Stanford Hospital, right? If that's the case, next 5 years, 7 years, where are the opportunities? So phase one of AI opportunities is really improving processes, improving patient care, supporting clinicians in providing appropriate care, reducing the burden on healthcare professionals, reducing the cost of those processes. Those are appropriate patient selection, making sure that patients are being triaged. There's a space called mechanical thrombectomy, a technology called mechanical thrombectomy, for acute ischemic stroke. Acute ischemic stroke is a blood clot in the brain, and for the longest time there was no meaningful technology. There was you could do a clot busting drug, but it wasn't as effective. And about 8 years back, there was a major evidence that came out for mechanical thrombectomy to be a very effective tool. The problem was that most patients didn't get to it. For a long time, only 5-7% of the patients who had stroke actually got to these comprehensive stroke centers that could benefit from this technology. It was a life-saving technology. It saved society money. It allowed patients to walk home the same day. And yet, only 7%, 8% of the patients in the US were getting access to it. And suddenly you have these tools like Viz.ai, I'm on the advisory board in full spirit of disclosure, Cure.ai, which is an India-based company. The companies like that are basically taking the CT scan images and moving the patients to appropriate hospitals, saying, you have a large vessel occlusion, you gotta go get mechanical thrombectomy. This is the use of those kind of AI tools. So most of the early use cases and early positive impact from AI is going to be within the existing healthcare system. But let's not be fooled. The real impact of AI in healthcare is going to be flipping it. So I'm going to pause there and see if there are any questions, and I would love a conversation, please.